Hello, this is Dr. Grande. Today's question is, are there any complicating factors on the clinical side when treating narcissistic personality disorder? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss any new videos. Now, when we talk about complicating factors on the clinical side, we're referring to variables that would affect the clinician that might impede or otherwise negatively affect the treatment of individuals with narcissistic personality disorder. Now, this subject matter isn't really discussed a lot in the mental health treatment community. A lot of times there's this idea that mental health clinicians are immune from a lot of complicating factors, particularly the main complicating factor I'm going to discuss here today, which is countertransference. Now, when we talk about countertransference, of course we first must understand transference. And transference is when a client has a certain type of feeling, thought, or behavior that they direct toward a clinician. And this particular reaction was really created or reflects something that is related to somebody else. So if a client has a particular relationship with their father or brother, and that type of feeling set, that type of reaction that they would have toward that person is directed toward a clinician, that would be transference. Transference is fairly common and really expected in clinical settings. Countertransference is when the clinician has feelings toward the client that are similar to what we see in transference. And a lot of times we expand that word countertransference to where it wouldn't necessarily have to be the way the clinician reacts toward another important person in their life. It could just be negative feelings, thoughts, and behaviors directed toward a client. Countertransference is generally considered to be negative. It's not considered to be helpful, although there are different discussions I've seen about positive countertransference. Also, countertransference, as I mentioned, has a affective, cognitive, and behavioral component to it, and there are different levels of countertransference. So to answer this question, I'm going to be using an article that was published in 2017 by Tanzili and colleagues, and it really looks at this countertransference and narcissistic personality disorder diagnosis very directly. It answers this question fairly well. Oftentimes when we discuss NPD, as I mentioned, there's this idea that counselors, mental health clinicians are immune from feelings of countertransference, and really this is for any mental disorder. We know with NPD that negative reactions are common from family, friends, and coworkers. A lot of times these negative reactions are what push individuals with NPD into therapy in the first place. So a number of individuals in the community that relate to people with NPD have these different negative reactions, and of course clinicians do sometimes as well. We also know that NPD is highly comorbid with other cluster B personality disorders. That would be histrionic, antisocial, and borderline personality disorders. So if somebody has NPD, there's a higher likelihood they would have one or more of those other personality disorders, but there's also a high likelihood that they would simply have traits from those other personality disorders. So NPD, as well as NPD that has other cluster B personality disorder traits, both of these presentations were studied in this article. So the findings from this study were actually fairly interesting. Now, when we look at countertransference, we're here going to consider a feeling and a behavior. And really there were three sets of feelings and behaviors that were found in this study. So with the first set, we see the counselor feeling demeaned, belittled, unappreciated, angry, frustrated, and resentful. So those were the feelings of countertransference. The behaviors of countertransference associated with those feelings, those were criticism, harsh comments, and judgment. Of course, we know all three predict negative outcomes in treatment. The next set of countertransference feelings included indifference, boredom, distraction, and withdrawal. And the main negative behavior seen here would be the lack of any type of emotional connection. The third category saw feelings of insecurity, incompetence, anxiety, and feeling ineffective and the behavior associated with these feelings was poor boundary management. Now, of course, maintaining boundaries is always important in any clinical setting. We do think of it as a particular challenge when working with personality disorders. So these were fairly interesting findings, and also they were findings specific to the NPD presentations that had comorbid cluster B personality traits. Here, clinicians reported feeling more disorganized, more helpless, and more inadequate than with clients that did not have other cluster B personality traits. These feelings could result in a clinician terminating treatment earlier than as would be normally indicated. So the NPD with cluster B personality traits presents special challenges in terms of countertransference. Now, another interesting finding in the study related to clinician variables. So there's this idea that one's theoretical orientation as a clinician, gender, and years of experience may predict different levels of countertransference. There may be some movement in the countertransference variable based on movement in those variables. Well, again, here, an interesting finding. Theoretical orientation did not predict any difference in the levels of countertransference, and gender didn't either. Years of experience, however, was an important factor. It had an important effect on countertransference. The higher the number of years of experience, the lower the levels of countertransference in terms of both the feelings and, of course, the associated behaviors. So what does all this tell us about the reactions of clinicians when treating narcissistic personality disorder? Well, we know that mental health clinicians are not immune from feelings and behaviors that can be negative. They're not immune from countertransference. Also, there are a lot of different types of reactions one can have when working with an individual with NPD. It's not just one set of reactions we could expect. Rather, there are a wide variety of reactions. And experience matters. Now, we know that experience matters when working with any type of mental disorder, but here in this article we see clear evidence that experience had an important effect on countertransference, specifically when working with individuals with NPD. I hope you found this description of clinician factors that can complicate treatment of NPD to be interesting. Thanks for watching.